What about some of the long-term side effects of bariatric surgery? That's a very good question. One of the most common ones could be nutritional deficiencies. Of course, that depends on what kind of procedure you had done as well. That can be addressed fairly easily by taking supplementation and adjusting your diet. Now, that can happen also in patients who've not had metabolic surgery. So it's not necessarily that that will certainly occur, but it all depends on the compliance with the diet. Second long-term side effects, again, it varies by procedure. In sleeve gastrectomy, one of the commonest things we see is reflux. So heartburn is fairly common. Even in the non-bariatric populations, about 25% of Americans will have heartburn at some point. And we think that's one of the main causes of that is actually obesity. You could possibly get what we call an internal hernia when you have a Roux-en-Y gastric bypass. So because you lose so much weight, even though from a technical standpoint, the way we do the suturing and we close what we call internal spaces, the bowel could actually loop sometimes around those internal spaces. This happens in the minority of patients. In our case, it's about 1% of the patients that we have, though the science and the literature and the studies say it's about possibly 3%, because we do close all of these spaces. So that's one thing that we are mindful of, and we do look at that. And again, you need to see your surgeon so they can determine if that is something that you may have or may not have.